Hi, my name is Catherine Ryan. I'll be presenting with my colleague Amanda Taisey. Amanda and I work at Maine Health Center for Tobacco Independence. Our team collaborates with behavioral health teams to integrate evidence-based tobacco policy and treatment into usual care. In this project, we partnered with Maine Behavioral Healthcare Residential Services to design and implement a tobacco-free campus policy for all 12 of their residential programs. The rate of cigarette smoking among adults has steadily declined over the decades. However, smoking rates remain high for individuals with behavioral health conditions. Many individuals with behavioral health conditions want to quit smoking. However, many behavioral health and substance use treatment centers do not have tobacco-free campus policy, and many do not offer comprehensive treatment. Establishing tobacco-free policy and creating low barrier access to evidence-based treatment within behavioral health facilities is key to closing this disparity. Today, we will share with you both the policy implementation process as well as the ongoing work to support MBH residential with the complex system change and culture change that comes with going tobacco-free. This slide is evidence of our project timeline, and I'm going to highlight some of the things on here. In September of 2019, all residents and staff were informed of the June 1st tobacco-free campus go-live date. In October of 2019, the multidisciplinary committee kicked off. This group reviewed existing and example tobacco-free policies and created a timeline for steps to reach our goal. By March 1st, 2020, the policy was finalized with approval from the MBH Policy Committee. One thing we wanted to highlight is that training was a large part of our implementation plan. CTI worked in collaboration with the MBH training and development team to create training for prescribers as well as training for residential staff. Due to COVID-19, all training had to be amended and delivered virtually. All staff completed training by May of 2020. Another key thing that we had planned was to host several open house forums for residents and staff so that we could review the policy, answer questions, and hear feedback. These forums were unfortunately canceled due to COVID-19. This was a big loss for our process. On May 1st, tobacco-free signs were distributed to each location along with quit kits for each resident. These quit kits included things like a stress ball to use in time of craving, as well as information on accessing care through the main quit link. And on June 1st, 2020, the policy went live.
One goal of this project was to ensure that evidence-based treatment pathways, which are counseling and medication, are accessible for residents and that the conversation feels safe and ongoing for them. Even though the goal of this tobacco-free policy isn't to make residents quit, research shows that individuals with behavioral health conditions want to quit and can quit. So reducing any barriers to that makes their quit attempts more attainable. One way we approached the goal of increasing treatment access was to work with MBH psychiatry and nursing teams to enhance main quit link referral workflow. As staff and residents adjust to the new policy, we don't anticipate seeing a ton of referrals come in immediately, but we are hopeful that our continued engagement with staff will support movement toward increased referrals in the future. So Catherine had referenced our survey earlier, and on the left side of the slides, you'll see staff responses, and on the right will be resident responses. The goal of this survey was to gauge resident and staff understanding of and attitudes towards the new policy. We learned that there are strong feelings across the board, which just speaks to the impact of nicotine addiction on individuals, but also the dedication and compassion of the staff for their clients. In reference to the last boxes on these slides, on both sides, a part of this process will be to have ongoing conversations with staff and residents as we continue to address the enormous cultural shift that has taken place in their environment. We'll continue to learn from staff and residents, adjust to seasonal changes, and provide additional training for peers and staff and resources from the main quit link. And lastly, I wanted to share a quote from one of the residential care workers, Kim Gerard, who worked with residents to improve the space where residents used to gather and smoke. Kim shared, "It is not at all a all manicured space, and it is far from perfect, but it looks and feels more like a place someone would call home because it invites the type of health and self-care we all need to be a part of. We have created an environment where if someone did want to quit their tobacco use, it would be easier to do so. However, the work is not done, and I have a vision where all healthcare workers are role models for the people they care for by practicing and teaching healthy lifestyle choices.
Thanks so much for joining us.